the Trans Health Program Lead at the Centretown Community Health Center, and one of the nurses there. Today, I'll be teaching you how to do a subcutaneous injection. To start off, we'll go through the equipment that you're going to need. So we have a sharps container here that you put your used needles in. You can get these for free wherever you purchase your injection supplies. We have something to wash your hands. I have a bottle of Purell, but you can also wash your hands in the sink with soap and water. I have the syringe I'm going to use, a larger needle to draw up the medication, a smaller needle that you're going to use to inject, a cotton ball in case there's a little bit of leakage after your injection, as well as a Band-Aid for the same reason, my medication, and some alcohol swabs. 2 of them are good. You can also get these at any drugstore. The first thing you're going to want to do before drawing up your medication is wash your hands. You're going to take your medication out of the box, and if it's the first time you're ever using the medication, there'll be a plastic cap on the top which you can flick off with this motion. The next thing you're going to want to do is look at the expiry date on the side of your bottle and make sure it's not expired. Then you're going to want to look at the medication inside and make sure that it's nice and clear, it has a little bit of a yellow tinge to it, and that there's nothing floating in it or any clumps. The next thing you want to notice is the concentration of your medication, which is how strong the medication is. Mine says 200 milligrams per milliliter, but yours might be 100 milligrams per milliliter. That's important to know to calculate your dose. The next thing that you're going to look at is your syringe. I use a 3 milliliter syringe, but you can also use a 1 milliliter syringe. If you look on the side of the syringe, it has markings that represent the amount of milliliters that you can put in the syringe. Mine are by half, so half, 1, 1.5, 2, 2.5, 3. If you have a 1 milliliter syringe, they'll be in increments of 0.1 milliliter, so it will look like 0.1, 0.2, 0.3, 0.4. The next thing you're going to want to do is open your syringe. You open it like this, sort of like a cheese string. Once it's open, put it down on your table. And the next thing is you're going to take your larger needle that you're going to drop the medication with. So grab that, and this one also opens similarly like a cheese string. Hold this so that you can see the end, but don't touch the end. And then grab your syringe, and you're going to twist them together, like this, and twist. Don't twist too hard because they'll be hard to get apart later. If the dosage on your box is given in milliliters, you'll just have to find that marking on your syringe. If your dose is given in milligrams, you're going to have to convert it into milliliters. You do this by knowing the concentration of medication in your vial. If you have 100 milligrams per milliliter, this is the conversion you'll use. If you have 200 milligrams per milliliter, this is the conversion you'll use. Now find that point on your syringe. Draw back the amount of medication that you'll be taking out. So in my case, I take out 0.3 of a milliliter. So if you look, the top of the plunger that's touching the wall is at the third line down, which is 0.3 on this syringe. The next thing you're going to do is you're going to clean the top of your bottle. So how you do that is you open the alcohol swab, you just rip the corner. Take your swab out and clean the top. Once that's ready and the top has been cleaned, you're going to take off the protective cap of the needle, like so, and you're going to put the needle in straight down and inject the air. The next thing you're going to do is flip the bottle over and pull the needle so that the tip of the needle is inside the liquid. And then you're going to pull back on the syringe to fill your vial. you can pull back more medication than you need. If there are any bubbles that you see at the bottom, air bubbles, you can flick like so to get the bubbles to come up. As you can see, I have some air at the top of the chamber. That's okay, you can just push it out. So keep it up and down and keep it vertical, and you can push out that air bubble. And push until the stopper is at the desired line for the medication. There we go. Like that. Once you're there and there's no air bubbles in the medication, little tiny air bubbles are okay. You can flip it over and pull the needle out. Then you can recap the needle carefully, like so. Now that you've drawn up your medication, the next step is to change the needle to the needle that you will use to inject. This is usually a 25 gauge 5/8 needle. That looks like this. Alright, so you're going to open this needle now the same way that you opened the other one. And now you're going to twist off the needle you used and twist it on your needle for injection. Now this one is ready to go. And you put this needle into the sharps container. The next step will be injecting the medication. Testosterone is given subcutaneously, which means that it's given in the fat. The best places to do it are either in your stomach, 2 inches away from your belly button, or in your thighs. Since you'll be doing these injections every week, it's important to rotate the site that you do it. So always change areas of your stomach or your thighs that you're going to be giving your injection. The best way to keep track of this is by writing it down in a book. Once you've selected the location you want to do your injection, you're going to want to clean the area with an alcohol swab. Use a circular motion going from the inside to the outside. And let the alcohol dry before you give yourself your injection. Next, you're going to remove the cap from the needle. Next, you're going to pinch the skin in the area you're going to inject it. Then you're going to insert the needle. Remember to keep the bevel up. You can either go at a 90-degree angle from your skin or at a 45. Once the needle is all the way in, you're going to push the plunger until all the medication is no longer in the syringe. It might be a little bit difficult to push the plunger down because of the thickness of the testosterone. Once the plunger is all the way to the bottom, and you can't push it any farther, hold the needle in your stomach for a few seconds before removing it. After removing it, make sure that there's no leakage or any bleeding. If there is, just use a cotton swab to wipe it off. And if you need to, you can put a Band-Aid on. Once you're done, put the cap back on your needle and put it away in the sharps container. And that's the whole process of doing your injection.